We're moving on to heel pain. Many, many causes of heel pain. We're going to talk about quite a few of them. First one is the one that most people know of, plantar fasciitis. Anytime you see the word itis, you know you're dealing with an inflammatory condition, right? Tonsillitis, appendicitis. So the plantar fascia is this white band that you see right here, okay? And when this ligament, it's not a tendon, it doesn't stretch, it's a ligament, when this becomes inflamed, that's what plantar fasciitis is. The classic symptom of plantar fasciitis is the person gets out of bed in the morning, they start walking, and they have significant pain on the bottom of their heel. Okay, that's a classic plantar fasciitis symptom. They start walking for a little bit. The more they walk up to a certain point, the better it gets. They go to sit down for a few minutes for a meal or at their desk. They go to get up again, same thing happens. Very tough to get going, improves with walking. If they keep walking, it gets even worse. Now, if you have plantar fasciitis for long enough, you get the next thing, which is a heel spur, which is what you're seeing right here. Okay, some of these heel spurs that I see are so large I could hang my winter coat from Chicago on them, okay? And what causes plantar heel spurs? The plantar fascia pulls so long and so hard that it actually elevates the coating off the bone and new bone fills in, and that's what the heel spur is. Calcaneal congestion. This is the third part of the triad of heel pain. The most mild cases of heel pain that I see is a patient that only has plantar fasciitis. Second level, when they have plantar fasciitis and a heel spur. The worst heel pain is when they also have calcaneal congestion. Calcaneal congestion essentially is like high blood pressure of the heel bone. In other words, we all know that the bones in the human body contain marrow, right? And that marrow can be under high pressure or under low pressure. As the heel pain gets worse and worse, the pressure increases in the heel bone, okay? And what happens is when I see a patient for heel pain, I take my hand and I cup it around their heel and I squeeze and I look at in their eyes. And if they have calcaneal congestion, I can see it immediately, okay? Let's talk about some other causes and then we'll talk about the treatments. People break their heel bone, and the most common way to break it is to fall off a ladder or a high place. And those people that get calcaneal fractures, and again, the calcaneus is the heel bone, also have to have a back examination because inevitably if they're falling off a high place, they hurt their heel bone, I have to send them to a spine specialist as well. Achilles tendonitis. When people get spurs on the bottoms of their heels, we can treat these with minimally invasive surgery or even other conservative means. When it occurs in the back of the heel, it's a whole different ballgame because what we're really, really worried about with any heel surgery in the back of the heel is we're worried about the Achilles tendon, okay? There are cases where people will be walking along and all of a sudden their Achilles tendon will snap. One of the reasons that cortisone injections are absolutely contraindicated for the back of the heel, but we do them on the bottom of the heel all the time very safely. There's a condition called Haglund's deformity. It's also known as pump bump, okay? And it's on the back of the heel. And the reason that it's called pump bump is, remember many years ago, ladies used to wear spike heels? Everyone who wore spike heels, because they were so unstable, used to get a bump in the back of their heel. But you can get heel spurs back here as well. And it's not a minimally invasive procedure. It's usually a surgery center or a hospital procedure. It doesn't usually involve the use of some hardware to actually anchor the Achilles tendon back in the bone. Next one, Calcaneal apophysitis or Seaver's disease. I have good news for you. None of us are ever going to get it. Okay? Why is that? It's a disease of youth. They are growing pains. Okay? There is a growth center in the heel bone, right in this area. Okay? And when adolescents are being active, as they often do, they will get growth pain. Sometimes we have to treat it with anti-inflammatory medicine. Sometimes we have to treat it with arch supports. But the good news is it has a 100% cure rate because everyone stops growing at some point and the pain stops. So that's what Seaver's disease or calcaneal apophysitis is. From a minimally invasive standpoint, we are able to treat most cases of plantar fasciitis, heel spur syndrome, and calcaneal congestion, all minimally invasively in the office. When it comes to the back of the heel, not recommended. The more toward plantar fasciitis only a person has, the more chance that they will not need surgery. The more you get to seeing a heel spur and we find calcaneal congestion, the more that we start thinking that that patient likely is a surgical candidate.